The government is reviewing your medical coverage right now. If you are on Medicare or Medicaid, they are checking whether you still qualify for your benefits. If you do not respond in time, you could lose everything. Your doctor visits, your medications, your medical equipment. Gone. This is not a drill. This is not a rumor. This is happening to millions of seniors across the country, and most of them have absolutely no idea it is coming. I need you to pay attention for the next 20 to 25 minutes. This is the most important healthcare information I will give you all year. I am going to tell you exactly what is happening, when it is happening, why it is happening, and exactly what you need to do to protect yourself. Not next week, not tomorrow, today. If you are watching this video, you or someone you love is likely on Medicare or Medicaid. You need to understand what is happening before it is too late. How we got here, the COVID pause and what changed. To understand what is happening right now, you need to know what happened during the COVID pandemic. This story starts in early 2020, and it affects your healthcare today. When the public health emergency was declared in early 2020, the government made a decision that affected tens of millions of people across America. They paused all medical eligibility reviews. Let me say that again. They completely stopped checking whether people still qualified for their benefits. This means that if you were on Medicaid, Medicare savings programs, or other government medical benefits during the pandemic, you kept your coverage even if your situation changed dramatically. You did not have to prove you still qualified. You did not have to submit documents. You did not have to renew. The government just kept sending your benefits regardless of what was happening in your life. Why did they do this? They said they did not want people to lose their health insurance during a deadly pandemic. They did not want Americans scrambling to prove their eligibility while they were also trying to survive a health crisis. That was the official reason, and it made sense at the time. Millions of people kept their coverage without jumping through the normal hoops. Some people got jobs that increased their income. Some people inherited money. Some people moved to different states. Some people's health conditions changed. None of that mattered during the pause. The government kept sending benefits. But here is what they did not tell people clearly enough. That pause was always temporary. It was a pause, not a permanent change. Think of it like pressing a hold button on your phone. The call does not end. It just stops for a while. And when the public health emergency ended, the reviews came back. The public health emergency officially ended on May 11, 2023. That is when the clock started running again. That is when the government resumed checking whether people still qualified for their benefits. But the reviews are not happening all at once. They are being done gradually, state by state, over a period that can stretch into 2026 or even 2027. The exact timing depends on where you live, which is why I am going to explain the state-by-state differences in detail later in this video. What matters right now is this simple fact. If you have not received a medical review notice yet, you probably will soon. If you have received one, your deadline might be coming up faster than you think. And if you miss that deadline, you could lose your coverage without ever knowing why. You could go to the pharmacy to pick up your medications and find out your coverage is gone. You could go to your doctor's office and learn that you owe full price for everything. This happens to people every single day, and it is preventable. CTA, if you found this warning useful, please hit the like button right now. This information could protect someone's healthcare coverage, and every like helps this video reach more people who need to see it. You are doing your part by hitting that button. What is a medical review, and why does it matter to you? Let me break down exactly what a medical review is. I want to make sure you understand this completely, because it affects your life in a very real way. A medical review is basically the government checking to see if you still deserve the benefits you are receiving. They want to know if your health condition still qualifies you. They want to know if your income and assets are still within the limits that make you eligible for help. They want to know if everything you told them when you first signed up is still true and accurate. For Medicare, this usually means checking whether you still have a qualifying disability or health condition. Medicare does not just cover people who are 65 and older. It also covers people of any age who have certain disabilities or specific diseases like end-stage renal disease. If you are on Medicare for one of these reasons, the government will periodically check to make sure you still have that condition. For Medicaid and Medicare savings programs, the review is different. These programs help people with limited income and assets pay for their health care. The review checks whether your income is still low enough to qualify for help. If you started earning more money, if you inherited assets, if your financial situation changed, you might no longer qualify at the same level, and the review will catch that. Here is the critical part that many people do not understand. These reviews are not optional. If you receive a notice asking you to verify your information, you have to respond. There is no choice here. If you do not respond, the government assumes you no longer qualify and they cancel your coverage. This happens automatically. They do not call you to remind you. They do not come to your house to check on you. They just send a letter, and if you do not reply within the deadline, your benefits stop, just like that. No second chances, no warning, nothing. For millions of seniors, this could mean losing help paying for Medicare Part B premiums, which cost around $190 per month. It could mean losing Medicaid coverage that pays for nursing home care, which can cost thousands of dollars per month. It could mean losing the low-income subsidy program that helps pay for Medicare prescription drug coverage, which could mean paying full price for medications that might cost hundreds or even thousands of dollars per month. These are not small benefits. These are the programs that keep many seniors from going bankrupt due to medical costs. These are the programs that allow people to stay in their homes instead of being forced into nursing facilities. These are the programs that give people access to the medications they need to stay alive. Who is being targeted? The groups at highest risk. Not everyone on Medicare and Medicaid is being reviewed at once. The reviews are being done in waves based on certain risk factors that make some people more likely to no longer qualify than others. Let me explain in detail who is most likely to receive a review notice. First, people who kept their coverage during COVID without going through normal annual renewals are the highest priority for reviews. If you stayed on Medicaid or a Medicare savings program from 2020 through 2023 without updating your information, the government knows you have not been reviewed in a very long time. They are starting with these people first because they represent the biggest gap in the system. Second, people whose income or assets may have changed significantly are being targeted. If you got a raise at work, if you inherited money from a relative, if you sold property, if you moved to a different state, or if you had any other significant change in your financial situation, you might no longer qualify at the same level of benefits. The review is designed specifically to catch these changes and adjust your benefits accordingly. Third, people with certain health conditions that require ongoing certification are being checked. If you are on Medicare due to a disability or a specific health condition that requires periodic recertification, you will likely face a medical review. The government wants to confirm you still have that condition and that it still meets the criteria for the benefits you are receiving. Fourth, people who moved or changed addresses recently are at special risk. If you moved and did not update your address with your health insurance plan or with the government, your review notice might have gone to your old address. You could miss the entire deadline without ever knowing a letter was sent. You could lose your coverage while thinking you are still enrolled. Fifth, people who are enrolled in both Medicare and Medicaid, which is called dual eligibility, face complex review situations. These people often have coverage through multiple programs at the same time, which means more opportunities for things to fall through the cracks. The review process for dual eligibles is especially complicated, and many people do not understand which program is reviewing them and what they need to do. If any of these descriptions apply to you, you need to be especially vigilant about checking your mail and responding to any notices you receive. Do not assume everything is fine just because you have not heard anything yet. The deadline you cannot ignore, understanding the time pressure. I need to be very clear about this part because it is the most important thing I will tell you today. Medical review deadlines are hard deadlines. There is almost no flexibility once the deadline passes, and the consequences are severe. When you receive a review notice, it will include a specific date by which you must respond. That date is usually 30 to 60 days from the date on the letter, though it can vary depending on the program and your state. The letter will clearly state when your deadline is. If you do not respond by that date, your coverage ends. Not slowly, not gradually. Immediately, the government does not give you a grace period. They do not send a second notice warning you that time is running out. They do not call to check if you received the first letter. They simply terminate your coverage and move on to the next case. Here is what makes this even more dangerous and more unfair. Many seniors do not even realize they received a review notice. The letter might look like junk mail. It might come in an envelope that looks like advertising or a credit card offer. It might go to the wrong address if you have moved recently. It might be written in language that is hard to understand, full of government jargon that confuses regular people. The government is not intentionally trying to trick you, but the system is set up in a way that makes it very easy to miss these deadlines. The deadlines are short, the notices are easy to ignore, and the consequences are devastating. This is why I am making this video. I want you to be ready. I want you to know what to look for. I want you to have time to respond before the deadline arrives instead of scrambling at the last minute. If you are watching this video right now and you have not checked your mail recently, go check it right now after you finish watching. Look for any letter from Medicare, Medicaid, or your state health insurance program that mentions a review, renewal, verification, or eligibility. Any of these words should catch your attention. Hash what you will receive in the mail, recognizing the notice. When the government sends you a medical review notice, it will come in the form of a letter. Here is exactly what to look for and what it will say so you can recognize it immediately. The letter will identify the program that is conducting the review. It might say Medicare, Medicaid, or a specific program name like the Medicare Savings Program, the Low Income Subsidy Program, or your state Medicaid program. The letterhead will have official government information on it, but it might not look as official as you expect. The letter will explain that you need to verify your information to continue receiving benefits. It will use words like renewal, review, verification, eligibility, or recertification. These are all terms that mean the same thing. The government is checking whether you still qualify. The letter will include a deadline. It will say something like you must respond by a specific date or your benefits will be terminated. That date will be clearly visible in the letter, and you need to write it down somewhere you will not forget it. Put it on your calendar. Put it on your refrigerator. Tell someone else what the date is so they can remind you. The letter will explain exactly what information they need. This could include proof of income like recent pay stubs or tax returns, proof of assets like bank statements or property deeds, proof of residency like utility bills or lease agreements, or documentation of your health condition like medical records or doctor's letters. They will tell you exactly what to send and where to send it. The letter will include instructions for responding. They might tell you to mail documents to a specific address, call a phone number to give information over the phone, or go online to a website to submit your information electronically. Follow those instructions exactly as they are written. Most importantly, keep a copy of everything you send. Make notes about when you sent it and how you sent it. If you mail something, use certified mail with return receipt so you have proof of exactly when it was delivered and that it was received. If you go online to submit information, print a confirmation page that shows you completed the submission. You want to be able to prove you responded in case there is any dispute later about whether you met the deadline. CTA, have you received a medical review notice in the mail recently? Leave a comment below and let me know if this information matches what you saw. Your experience can help others know what to expect, and sharing your story might help someone who is confused about what they received. Hash the documents you will need to gather. Be prepared before the notice arrives. Before your review deadline arrives, you need to gather certain documents. The exact documents depend on your specific situation, but here is a comprehensive general checklist that covers most cases so you can get ready now. For income verification, you will need recent pay stubs from the last few months, your most recent federal tax return, Social Security award letters that show your monthly benefit amount, pension statements if you receive pension income, and any other documents that show money coming in. If you are self-employed, you will need profit and loss statements or business tax ret. Earns showing your business income. The government wants to see everything that counts as income. For asset verification, you will need bank statements from all your accounts for the last few months, investment account statements showing stocks, bonds, and mutual funds, retirement account statements like 401k and IRA balances, property deeds showing any real estate you own, vehicle registration documents, and any other documents that show what you own and how much it is worth. They want to know the total value of everything you have. For identity verification, you will need a government-issued photo ID like a valid driver's license or passport. They want to confirm you are who you say you are and that you are the person who is supposed to be receiving these benefits. For health condition verification, You will need recent medical records that document your condition, letters from your doctors explaining your diagnosis and treatment, a current list of all your prescription medications, and any other documentation that proves you have the condition you claimed when you enrolled. If your condition has changed or improved since you enrolled, be honest about it. Trying to hide information or provide false documentation could result in fraud charges, which are serious and can lead to penalties, fines, or even criminal prosecution. For residency verification, you will need utility bills that show your name and address, lease agreements or mortgage documents, or other official documents that prove where you live. Gather these documents now before you receive a notice. Do not wait until you get the letter to start looking for this information. It takes time to gather everything, especially if you need to request documents from banks, doctors, or other sources. The deadline will be approaching faster than you think once you get the notice, so get ready now. How to respond step by step, the complete process. Let me walk you through the exact steps you should take when you receive a medical review notice. Follow these steps carefully and in the order I give them to you. Step 1. Read the letter carefully the moment you open it. Do not throw it away or put it in a pile to deal with later. Do not set it aside thinking you will get to it next week. Read every word in the letter. Highlight the deadline. Write it on your calendar. Make a note in your phone. Tell someone else what the deadline is. Make sure you understand exactly what they are asking for and exactly when you need to respond. Step 2. Gather the required documents. Use the checklist I gave you earlier in this video. Check each item off the list as you find it. If you are missing something, note what you need and how you will get it. Give yourself a realistic timeline for getting missing documents. Step 3. Make copies of everything before you send it. Before you mail any document, make a copy and keep it in a safe place. Before you upload any document online, save a copy on your computer. Keep them in a folder with the date and what the document is. In case something gets lost in the mail or there is a dispute later about what you sent, you will have proof. Step 4. Submit your response well before the deadline. Give yourself plenty of time. Do not wait until the last day or the last week. Mail things early. Submit online early. Call early if that is an option. Things can go wrong at the last minute, so give yourself a buffer. Step 5. Confirm receipt of your submission. After you submit your response, follow up to make sure they actually received it. Call the phone number on your letter if one is provided. Check online if there is an online portal where you can track your case. Make sure they have everything they need and that your case is being processed correctly. Step 6. Wait for a response and keep your copy of everything. After you submit your information, the review process takes time. They will send you another letter letting you know the outcome of your review. Keep that letter with your records along with everything else you submitted. If you miss the deadline for any reason, do not give up and do not assume all is lost. Call the number on the notice as soon as you realize you missed it and explain what happened. In some cases, they may allow you to restart the process or request an extension or reinstatement. This is not guaranteed, but it is always worth asking. The worst they can say is no. State by state, where the reviews are happening and when. The medical reviews are not happening all at once across the country. States are handling them at different speeds based on their own administrative processes, available resources, and backlogs. This means the timeline for when you might receive a notice depends heavily on where you live, and you need to understand your state's situation. In some states, the reviews are happening very quickly. These states ran through their backlog fast and are now back in norma. Annual renewal cycles. If you live in one of these states, you might have already received a notice or will receive one very soon. Do not assume you have more time just because you have not heard anything yet. In other states, the reviews are moving more slowly. These states have larger backlogs from the COVID pause or fewer resources available to process cases efficiently. If you live in one of these states, you might have more time before your notice arrives, but do not count on it. The delay is not a guarantee of anything, and it could end at any time. In some states, the reviews are being done in waves based on when your coverage was last verified. People who have not been reviewed since before COVID are being prioritized. If you have not updated your information since 2020 or earlier, you are likely in this priority group regardless of what state you live in. To find out the specific status in your state, you can contact your state Medicaid office directly or call your state health insurance assistance program. These programs offer free counseling specifically to help seniors understand their coverage and navigate the renewal process. They can tell you where your state is in the review process and what to expect. Do not assume your state is moving slowly enough that you have plenty of time. Do not assume you will get plenty of advance notice before your deadline. Check your status now and be ready to respond at any time. The worst case is that you prepared early and nothing happened. The best case is that you were ready when the notice arrived. CTA if you want to stay ahead of these changes and be notified about future updates like this one. Subscribe to this channel now. Click the subscribe button and turn on notifications so you do not miss critical information that affects your healthcare. I will keep bringing you warnings like this one as new developments happen. Hash the counter-arguments, what critics are saying and why they are partially right. Before I go further into the details, I need to address what some people are saying about these medical reviews. You might have heard different opinions from mainstream media, from government officials, or from people online. Some of what you hear might be true, and some of it might be misleading. Let me help you separate fact from fiction. Critics say the reviews are really a way to cut people off from healthcare to save the government money. They say the government is using the reviews as an excuse to remove people from the rolls and reduce spending on healthcare programs. There is some truth to this concern. The reviews do serve a financial purpose for the government. They want to make sure only people who truly qualify are receiving benefits. When people who do not qualify are removed from the program, it saves money that can be used for other purposes or to extend benefits to people who do qualify. But here is the other side of that argument that the critics often ignore. The reviews also exist to make sure people who do qualify are receiving the correct level of benefits. If you have a health condition that qualifies you for a program, you absolutely deserve to be in that program and receive every benefit you are entitled to. But if your condition has improved or your financial situation has changed and you no longer qualify at the same level, the system should catch that. The system should make sure benefits are matched to actual situations. That is not cruelty. That is what the program is designed to do. Critics also say the reviews are overly complicated and designed to confuse people into missing deadlines intentionally. There is strong evidence that this is true. The letters are often written in confusing government jargon that regular people struggle to understand. The deadlines are often too short for people to gather the required documents and submit them on time. The system does seem to work against people who are not prepared or who do not have help navigating the bureaucracy. The government says they have outreach programs to help people through the process. They say they are sending reminders and working with community organizations to make sure people do not fall through the cracks. That is partly true. There are some programs designed to help, but many seniors are still falling through the cracks despite these efforts because the programs are not reaching everyone who needs help. The bottom line is this. Whether you think the reviews are fair or unfair, whether you think they are a good use of government resources or a waste of money, whether you agree with the policy or disagree with it, they are happening. You cannot change that. The only thing you can control is how prepared you are to respond when your notice arrives. Do not let the politics distract you from the practical task of protecting your own healthcare coverage. Hash the real stakes. What actually happens if you lose your coverage? Let me be very direct with you about what is at stake here. This is not abstract. This is not hypothetical. If you lose your Medicare or Medicaid coverage, your life can change dramatically in very short order, and the consequences can be severe and lasting. If you lose your Medicare Savings Program coverage, you will have to start paying your Medicare Part B premiums out of your own pocket. In 2025, that premium is around $190 per month, and it comes directly out of your Social Security check before you ever see it. That is over $2,000 per year that you did not have to pay before. For many seniors living on fixed incomes of $1,500 or $2,000 per month, that is a crushing amount of money that forces them to choose between health care and other necessities like food and utilities. If you lose your low-income subsidy for prescription drugs, you will have to start paying full price for your medications. For some seniors, this means choosing between medications and food. For others, it means skipping doses or splitting pills in ways that are not safe or recommended by their doctors. Some medications that cost $20 per month with a subsidy could cost $200 per month or more without it. For seniors with multiple prescriptions, the total cost could be thousands of dollars per month, which is simply not affordable. If you lose your Medicaid coverage, you might lose access to doctors who accept Medicaid, which could mean having to find new doctors who take Medicare or private insurance. You might lose prescription drug coverage through Medicaid. You might lose coverage for nursing home care, which costs thousands of dollars per month without government help. You might lose coverage for home health aides who help you with daily activities like bathing, dressing, and eating. These are not optional services for many seniors. They are the difference between living independently in your own home and being forced into a nursing home. If you lose your coverage and then need to re-enroll, the process is not simple or quick. You have to go through the entire application process again from scratch. You have to gather all your documents again. You have to wait for your application to be reviewed and approved. You might have a gap in coverage during that time where you have no help paying for health care. And if your situation has changed in a way that makes you ineligible, you might not be able to get back on the program at all. This is why the reviews are not something to take lightly or to ignore. Your healthcare coverage is not a game. It is not an abstract policy debate. It is your health and your life and the lives of your family members who depend on you. CTA, if this video is helping you understand what you need to do, please share it with someone you know who might also be affected. Many seniors do not know about these reviews, and you could help protect someone by sharing this information. Your share could make a real difference in someone's life. How to prepare right now. The action plan for today. Even if you have not received a notice yet, you should start preparing right now, today, this very moment. Here is exactly what you need to do to get ready so you are not caught off guard when the notice arrives. First, update your contact information with every program you are enrolled in. Make sure the government and your insurance plans have your current address, your current phone number, and your email address if you have one. If you have moved recently, update your address with Medicare, Medicaid, and any other programs you are enrolled in immediately. This is the simplest and most important thing you can do to make sure you actually receive your notices when they are sent. Second, check your current enrollment status. Go to the official Medicare website or call Medicare directly to confirm you are still enrolled and your information is correct. Find out when your last renewal was completed. If it has been more than a year, you might be due for a review soon and you might not even know it. Third, gather your documents now. Go through the checklist I gave you earlier in this video. Make sure you have recent copies of everything. Put them in a folder or a box where you can find them quickly when you need them. Do not wait until you get a notice to start looking for this information. Some documents take time to obtain from banks or doctors' offices. Fourth, know who to call. Write down the phone numbers for your state Medicaid office, for Medicare, and for your state health insurance assistance program. Keep these numbers in an easy-to-find place like on your refrigerator or in your phone contacts. When you get a notice, you will need to be able to call quickly to ask questions or confirm receipt of your submission. Fifth, tell someone you trust what you are doing. If you are not comfortable handling this alone or if you are worried about forgetting deadlines, tell a family member, a friend, or a caregiver. Give them permission to help you. Make sure someone else knows what is happening with your coverage so they can help you watch for notices and meet deadlines. Common mistakes to avoid. Learn from others who have failed. Let me tell you about the most common mistakes people make when they receive medical review notices. Avoiding these mistakes is just as important as doing the right things, so pay close attention to this section. The biggest and most devastating mistake is ignoring the letter entirely. Some people see the envelope and assume it is junk mail or advertising. They throw it away without reading it. Weeks or months later, they find out their coverage has been canceled and they have no idea why. Do not make this mistake. Read every single piece of mail you receive from Medicare, Medicaid, or any government health program. If you are not sure whether something is important, open it and read it anyway. The risk of ignoring something important is too high. The second biggest mistake is waiting until the last minute. People get the letter, read it, and then put it in a pile to deal with later. They plan to get around to it next week or after they finish something else. They tell themselves they have plenty of time. Then the deadline arrives and they have not done anything. Start working on your response immediately after you read the letter. Every day matters. The third mistake is not sending complete information. The letter will tell you exactly what documents to send and exactly what information they need. Some people send partial information hoping that will be enough to get by. It is not enough. Send everything they ask for. Do not leave anything out. Missing documents is one of the top reasons applications get rejected. The fourth mistake is not keeping copies. When you send your documents, make copies first. Keep records of exactly what you sent and exactly when you sent it. If they claim they did not receive something, you need proof. Without proof, you have no way to dispute their claim that you missed the deadline. The fifth mistake is not following up after you submit your response. After you send in your documents, do not just assume silence means everything is fine and your case is being processed correctly. Call or check online to make sure they received everything they need. Confirm that your case is moving forward. Ask if there is anything else you need to provide. The sixth mistake is throwing away the notice after you respond. Keep every piece of mail you receive related to this review, including the original notice, your response, and any confirmation you receive. Keep everything in a safe place where you can find it if there is a problem later. Hash what to do if you have already missed the deadline. If you have already missed a deadline, do not panic. There might still be things you can do to fix the situation. Here are your options in order of what to try first. First, call the number on your notice immediately. Explain that you missed the deadline and ask what options are available to you. In some cases, the agency may allow you to request a reinstatement or submit late documentation if you have a good reason for missing the deadline. This is not guaranteed, but it is always worth asking. The worst they can say is no. Second, check if you qualify for a special enrollment period. If you lost coverage due to missing a renewal, you might have a window of time to re-enroll without waiting for the next open enrollment period. Special enrollment periods are designed for exactly these situations. Third, explore other coverage options while you work on restoring your original coverage. If you cannot get your original coverage back immediately, look into other options like COBRA coverage if you have a former employer that offers it, coverage through the health insurance marketplace where you might qualify for subsidies, or other state programs that might be available to you while your situation is being resolved. Fourth, get help from a counselor right away. Contact your state health insurance assistance program. They can help you understand your options and may be able to advocate on your behalf with the government agency. They deal with these situations regularly and know what works and what does not. Fifth, do not give up. Losing your coverage is serious, but it is not necessarily permanent. There are steps you can take to try to fix the situation, and sometimes those steps work. But the sooner you take action, the better your chances are of restoring your coverage. Hash the future outlook. What happens after 2026 and beyond? I want to look ahead now because what is happening with these medical reviews is part of a larger picture that will affect seniors for years to come. And understanding the big picture helps you make better decisions today. The review process is expected to continue through 2026 and into 2027 as states work through their backlogs from the COVID pause. After that, the system is supposed to return to normal annual renewal cycles where your eligibility is checked once per year on a regular schedule. But normal does not mean simple, and you will still need to be vigilant about responding to renewal notices. The government is also implementing new technology and systems to make the review process more efficient. Some of these changes will make it easier to verify eligibility and receive renewals without having to send as much paperwork. Other changes might create new complications or gaps in coverage if the systems do not work correctly. Technology is not always perfect, especially when it is handling something as important as healthcare coverage for millions of people. There's also ongoing political debate about the income and asset limits for Medicare savings programs and other programs. Some politicians want to expand eligibility to cover more seniors who are struggling but not quite low enough to qualify under current limits. Others want to tighten eligibility to reduce costs and make the programs more targeted to only the poorest seniors. The outcome of these debates could affect what programs you qualify for in the future. The long-term trend is toward more automated verification systems. The government is working on ways to automatically check your income and assets using data from the Internal Revenue Service, the Social Security Administration, and other agencies. This could make the renewal process faster and easier because you would not have to send in as many documents yourself. But it could also create new problems if the automated systems make errors, or if your information in different databases does not match up correctly. For now, the most important thing is to stay vigilant about your current coverage. Do not assume the system will take care of you automatically. Do not assume that because you have been enrolled for years, you will always be enrolled. Take responsibility for your own enrollment status and be ready to respond to reviews when they come. The government will not give you a second chance if you miss your deadline. CTA questions about your specific situation? Leave them in the comments below and share what you are dealing with. I read every single comment, and your question might help others who are in the same position. Sometimes knowing you are not alone makes a big difference. How to get free help. You do not have to navigate this alone. I want to make sure you know about the free resources available to help you navigate this process. You do not have to figure this out alone, and you should not try to. There are people and organizations whose job it is to help you. Your State Health Insurance Assistance Program, also called SHIP, provides completely free counseling to Medicare beneficiaries. They can help you understand your coverage options, complete renewal forms correctly, navigate the review process, and appeal decisions if your coverage is denied. This is a completely free service funded by the federal government, and it exists specifically to help people like you. You can find your local SHIP by calling the Medicare phone number or searching online. Do not be afraid to use this service. They are there to help you. Your local area agency on aging can also provide help and referrals to other resources in your community. They often have social workers on staff who can assist with healthcare coverage issues, and they can connect you with other services you might need like transportation to medical appointments, meal delivery programs, or home modification assistance. If you have a disability, your local Center for Independent Living may have staff who specialize in helping people with disabilities navigate healthcare coverage issues. They understand the specific challenges you face and can provide targeted assistance. Community organizations like the AARP, local churches, and senior centers often have volunteers who are trained to help with these issues. Some of these organizations hold events where you can get in-person help with your renewal paperwork. Do not pay anyone who contacts you offering to help with your medical review. Scammers target seniors during enrollment and renewal periods because they know you are worried about losing your coverage. They might call you, email you, or come to your door offering to help for a fee. Legitimate help is free. If someone asks you for money to help with your Medicare or Medicaid renewal, that is a scam. Report them to the authorities and do not give them any personal information. The simple checklist for this week, your action plan. Let me give you a simple, straightforward checklist of things to do this week to protect your healthcare coverage. Do these things in order, and you will be much better prepared than most people. First, check your mail TOTA. Why right now if possible? Look for any letters from Medicare, Medicaid, or your state health insurance program. Look specifically for words like review, renewal, verification, eligibility, or recertification. If you find something, open it immediately and read it carefully. Second, update your address with Medicare and Medicaid if you have moved recently or if your address in their system might be outdated. Call the Medicare phone number or go online to update your information. This one step could prevent you from missing a critical notice. Third, gather your documents using the checklist I gave you earlier. Start collecting the papers you would need for a review. Put them in one place where you can find them quickly. Do this before you get a notice so you are ready. Fourth, write down the phone number for your state health insurance assistance program. Keep it somewhere you can find it easily. Put it on your refrigerator next to other important phone numbers. Fifth, tell a family member or friend what you learned from this video. Ask them to help you watch for any notices that come in the mail. Make sure someone else knows what is happening with your coverage so they can help you if you miss something. Sixth, if you have already received a notice with an upcoming deadline, start working on your response right now. Do not wait until tomorrow. Start today. Every hour matters when a deadline is approaching. These steps take less than an hour to complete, and they could protect your healthcare coverage for years to come. There is no reason not to do them. The bottom line, what you must remember. Here is everything you need to remember from this video, condensed into the essential points you must carry with you. Medical reviews are happening right now for millions of seniors on Medicare and Medicaid across the country. These reviews check whether you still qualify for the benefits you are receiving based on your income, assets, and health condition. If you do not respond to a review notice by the deadline, you will lose your coverage. There is very little flexibility once the deadline passes. Gather your documents now before you receive a notice. Do not wait until the last minute when you are stressed and rushed. Update your address with Medicare and Medicaid so you actually receive your notices instead of having them go to the wrong address. Use free resources like your state health insurance assistance program to help you navigate the process. You do not have to pay anyone for this help. Do not pay anyone who contacts you offering to help with your renewal. Legitimate help is free. Anyone who asks for money is a scammer. If you miss a deadline, call the number on your notice immediately and ask about your options. Do not assume all is lost. This is your health care, your coverage, your life and your health. Do not take it for granted. Do not assume someone else will take care of it for you or remind you of deadlines. Take action today to protect what you have earned and what you need to survive. Final call to action. Help us spread the word. If this video helped you understand what is happening with medical reviews and what you need to do to protect your coverage, please do 3 things for me right now. First, hit the like button. Every single like helps this video reach more seniors who need to see this information. You might be watching alone in your living room, but together we can spread this warning to thousands and thousands of people. You are doing your part by hitting that button. Second, subscribe to this channel and turn on notifications. I'm going to keep bringing you important updates about healthcare coverage, financial protection, and senior advocacy. I will warn you about changes before they affect you. Do not miss anything by forgetting to subscribe. Hit the subscribe button, turn on the bell. It takes 2 seconds and it could make a huge difference in your life. Third, share this video with someone you care about. Maybe a parent, maybe a grandparent, maybe a neighbor who is on Medicare or Medicaid. Maybe a friend who might be going through a review right now and does not know what to do. They need to know about these reviews and they might not see this information anywhere else. A simple share could protect someone's healthcare coverage. And if you have any questions, if you have received a medical review notice and want to share your experience, or if you want to tell us what happened when you responded to your notice, leave a comment below. I read every single one, and your story might help someone else who is going through the same thing. You are not alone in this. Thank you for watching. Take care of yourself and your family. And remember, when it comes to your healthcare, there is no such thing as being too careful. Stay vigilant. Stay prepared. Stay covered.